Good afternoon. I see some very friendly faces here, some familiar ones and some new ones. Yeah, really excited to see the list of folks that at least registered for today's session. We've got representation from a lot of different sectors, folks at the local level, county level, state level. So yeah, welcome in. Happy New Year to many of you who we may not have seen quite yet in the new year. As I said before, today's session is in the lunch hour, so feel free to eat and kick your feet up, take a bite, and sit back and relax and enjoy. Um, we are really looking forward to today's session. We're going to start our first 30 minutes really focused on celebrating the progress that we have made as a network towards our shared goals in 2023, and then talk about the path ahead for 2024. So, some of the goals that we would like to get accomplished. And then in the second half of the program, we're going to open it up to the group for feedback, questions, concerns about the 2024 plan. So I know our school leaders really want to hear from you. So please be prepared to jump in. You can text questions in the chat as we go along, or just save them for that second half of the program. I'm going to be talking as little as possible and handing off the microphone to our leaders at Renton School District. And then today we also have a leader from City of Renton who's going to join us, MaryJane Van Cleave. And MaryJane is at a city retreat right now. So the plan is for her to jump in at that 12:20 mark for about 10 minutes and give us a little bit of her time. And then she's going to have to jump to that retreat. So super appreciative for her to be on today. So quick reminder, closed captions are available. So you can click the CC button if you need them. Brian's going to be working in the background, my colleague, to make sure that everyone except the facilitators and presenters will be muted until we get to that question session when folks can come off mute. The event will be recorded and shared out with participants who may, have wanted to listen to the session but not be able to attend at this time. All right, and with that, I'm going to hand it over to Victoria Blakeney, or Vickie, as she goes by, the Director of Student Services at Renton School District. Vickie, take us away.
Thank you. Thank you so much for having me. I am just going to start by saying how exciting it is to see all these names. I can't see very many faces, but to see all these names, because this is the beginning of this really lovely dream. And it's wonderful to see so many people starting to buy into this and help us make this thing happen. So I just want to tell you thank you from somebody that's me, who has worked in education. My whole career has always been in the field of education, and my parents were both teachers. So this is just kind of how I've grown up. To be able to understand what we need from community and support with our community and the different sectors in our community in terms of mental health, et cetera. I have a narrow ability to make that happen because my whole scaffolding is around education and schools. So the more that I bring in and the district brings in and the community brings in these partnerships, the more that we can accomplish together. And it's not just me trying to figure something out from my narrow lens. So I get so excited when I see other really good brains around this work with us. So anyway, I just want to thank you for being here. So I would like to just start by kind of giving you the vision for how this is coming about and where we're hoping to get to. Sort of, Adam always calls it our North Star vision. So the dream is this: community and the schools working together so that our students who come to the schools have the social, emotional, and mental services that they need. But I consider it sort of a no wrong door approach. If a student comes to us and they need something, how do we get them the supports that they need when they need it in the most effective, efficient way possible for those students. And so the building of this work with the Renton Learning Network is the beginning of that. That's something that we've wanted since I started this job. And now to watch it start coming into fruition is what we're excited about. So there's a bill out right now that's on the Senate called Senate Bill 6216, and it says in quotes, I'm going to read the quote to you: schools are a natural setting for prevention and early intervention efforts and provide aftercare and ongoing support because they are often a hub. So when we're talking about mental health, that's what they say schools are these hubs, and behavioral health and substance abuse prevention, etc. The thing is, though, that the people that are in the schools, like me, we're teachers, right? So we're trained on English and math and science and things like that. So to be able to serve as a hub, like they're talking about, but with the community as our partner to make this thing happen is really the goal. So that a student comes to us with whatever presenting issue they have, and we say, okay, great. And we are able to reach out to the right community partner at the right time. And it's not based on which counselor had which relationship with which community partner, that sort of thing. It's really all of us as Renton working together to make sure that the student gets the service that they need and the family gets the support that they need in turn. So to get there, we have a handful of strategic priorities. And so the strategic priorities came from a lot of work that came with our last few years of working with the Renton community partnerships. And so this is not just my strategic priority, but these are the priorities that came out of that early work with this Renton Learning Network. But I just wanted to make sure that we're all on the same page with those. The first is that one of our priorities is that we increase our ability to offer social and emotional learning to our students across Renton, ensuring that they better understand their own thoughts and emotions. And by doing so, we're able to break the stigma around mental health and substance abuse supports for students. So the idea that all students should have access to culturally responsive, evidence-based social emotional learning strategies and practices, so that these are skills that they learn and that youth help us with that implementation and help us to figure out how to break the stigma so that they get the help that they need. To do that, we have really put a number of our resources and support and time into this SB-SBIRT and Referral Hub, which I believe you'll hear more about coming up. But it's this idea that we can screen our students for and then provide a brief intervention and a referral to treatment as necessary. Thank you to our partners from King County that are helping us to make this possible. And then we're building a referral hub from there that I'm sure you'll also hear more about as we go along, but that's one of our priorities. And then finally, of course, it's important to us that all of this work is sustainable and ongoing through, well, actually through time immemorial. We think all kids are always going to need connections to the right services when they need those. So those are our priorities with this work, and the priorities that our Renton Learning Network have determined together to be where we're going to focus our energies right now. Now, the good news is that this work isn't being done just in a vacuum. It's being done with our Renton Learning Network, and in the Renton School District, one of our like primary champions of this work is Devyna, who has really been a champion and a visionary in this.
Thanks so much, Vickie. Hi, everyone. I am Devyna Aguon. I'm a mental health facilitator for Renton School District. And some of you I have had the privilege to meet and work with and do and really like watch this grow. So I call this my little baby that I'm able to help raise with other people, because one of the things that I really believe in is that it does take a village, right, to do this kind of work and to help our students and families together, because we all are serving the same students and families. And so I'm honored and privileged to be able to share what we have accomplished so far in 2023. And one of those things is to be able to expand and continue to fund some additional supports that we have been able to have at the district level for all of our schools, and that is through our SEL department. So through that, we've been able to hire 5 additional staff, including 2 social workers, and my role has shifted. And so some of you, when I first started working with you, you may have recalled my position was the SEL facilitator, so social emotional learning facilitator. And because of that expansion and because of the work that we're doing to really address the social emotional needs of our students and how they're getting access to those services, we had shifted, we have changed my position title to mental health facilitator, so that way we can continue to do this work and continue to reduce that stigma that mental health has attached to it. Through this work, we've been very fortunate. Some of you may have known and may have seen it through the community or media that we have launched our partnership with the Sounders FC and Rave Foundation, as well as Providence, to be able to promote youth mental health and wellness. And so through this partnership, we've been able to work with Providence Work to Be Well, and Sounders FC and Rave Foundation to host mental health and wellness assemblies across our district at elementary, middle, and high schools. We've been also able to train teachers in looking at the resources of the Work to Be Well curriculum, which is a free curriculum that can be accessed and used as a resource for advisory. So we've been able to train and also coach advisory folks, or the teachers who are in charge of advisory, of how to implement those and how those resources can be used. And right now we are currently providing those, digging deeper into those resources with 4 particular schools, including Dimmitt, Nelson, Tally High School, and Lindbergh High School. And through this, they've been able to meet with students to identify what are the community needs for their school, and what are some of the things that is most appropriate to address when it comes to the curriculum, and be able to share. Through that, they are also creating mental health clubs in the schools. And so it's really great to see things being launched this way. And then we've been very fortunate, very fortunate, through Providence Wellbeing Trust. They have been able to fund Hazel Health, which is a telehealth service for our students pre-K through 12th grade. And so, as you can see, there were 308 students referred to this, which has been a real, I think, a real relief for a lot of our schools, our families, and then also our community providers, right? So I just received word, we're up to 333 as of today. So thank you, Kier. And so it is really great to be able to work together as we figure out how do we as a community be able to piece this together, because we all know that there's wait lists, right? And there's turnover. And so how do we work together to address the needs? Because it's not going away. And so being able to rely on this as a resource has been really helpful. And through this, we've been able to also launch our SB-SBIRT program at Nelson. So Dimmitt Middle School, we piloted that there last school year, and now this school year we've been able to start screening our entire 7th grade level at Dimmitt Middle School. And then at Nelson we started a pilot there, so they've were able to screen a class so far. And total so far we've screened 123 students, and through that we've been able to refer through to Hazel Health, as well as the Renton Referral Hub. And so that is one thing, like, I'm really excited to share, because we were able to get a couple referrals for the Renton Referral Hub and be able to pilot that to see how that access is and what that looks like for our students, our caregivers, our counselors, providers, and the system in general. And so really excited to be able to share that. It was no small task for everyone. We have 8 providers who are fully onboarded, and we're continuing to onboard other providers as well. And so, you know, it is no small task. As you know, it is very difficult, and it can take a lot of work time and effort on everyone's part and collaboration to put all of these systems together and figure out how do we make this FERPA and HIPAA compliant um, when we're working with these types of systems. So we really wanted to express deep gratitude to our schools and our providers for demonstrating that this is really possible to do so. And we really want to be able to also express gratitude to the City of Renton and OSPI for believing in this work and providing us with the startup capital to get these systems up and running. And so because of the funding through those two entities, we've been able to do this work and continue doing that work. And we're one of the next tasks that we are really trying to work on is focusing on expanding the work to serve more students and make sure we can braid all the funding together to sustain this work. And we'll talk more about that once we talk about our goals for 2024. But first, I would like to pass it on to Adam, who will introduce our next special guest.
Well, let me just quickly introduce MaryJane Van Cleave from City of Renton. MaryJane was formerly the administrator of Equity, Housing, and Human Services. She can talk more about this, but that department or division has been kind of reorganized, and so MaryJane's now with Parks and Rec leading that program, which Human Services is still underneath now Parks and Rec. MJ's or MaryJane's been an incredible leader in this work, working together with Vickie and Devyna, and none of this, especially Referral Hub work, would be possible without her leadership. So without further ado, I'll pass it over to MaryJane.
Good afternoon, everyone. I apologize. I'm at our mayor's retreat right now, and technology is not my friend. So I'm on my phone, and I apologize if I can't see everyone's faces. I'm just jumping into the conversation. But the biggest thing is I wanted to say is the city is extremely proud and supportive of the hub. I think we are trying to learn from the innovation and the efforts that the school district has made, to the point where what we do for human services predominantly is we broker out our services. So that's where we contract and we fund many organizations that meet a variety of needs of folks who are typically facing some sort of crisis. The biggest thing I just wanted to share is that the structure we had selected nonprofits is the process is going to be opening soon. The challenge we were facing and are still facing is, are we funding the right organizations? And the benefit and the value we're looking at with this portal is making sure that the city is funding organizations that are going to help families and students thrive and hopefully seek any assistance that they need for whatever journey they're on as individuals. And we couldn't do that without the hub. We couldn't do that in terms of understanding how to better align. So we're looking to replicate some of the systems that you have put in place, and figuring out how to integrate and make access to resources significantly easier on a larger scale with city resources. But the biggest thing is we're looking to you and trying to learn from what you've established and figuring out how do we adapt our systems to further complement yours. And I couldn't have done that without Adam, but I'm extremely happy and glad that the city was able to support and just provide some seed money. But the biggest gain, I think, is going to be learning more about the experience and figuring out what we can do on our end as well.
If you have a minute, talk a little bit about some of the data related to the population that you're serving at Human Services and overlap with Renton School District.
Yeah, so thank you for that. The city participates in a 15-city consortium. So that means a nonprofit or organization submits one application. It comes into this repository, one portal. What that does is it allows them to apply with more than one city, and it's supposed to simplify their process. Historically, we had never pulled the data or demographics from there. Recently, we did that, and I think some of that information is in the slides, but we finally have a better understanding, not just if they're residents or not, because that's typically the reporting we get from the providers, but more so who is being served, and we found a good majority are women, and I think nearly a third are children. So we definitely see now that there's overlap specifically with the school district, and I'm sure some other providers on this call. But it's pretty hard to realize that those facing most crisis right now are typically women and children. It's not as much of just homeless as I think we originally thought, but it's much more of the extremely low income and working poor.
Thanks for that, MJ. I know some of the kind of statistics around hidden homelessness, as a lot of folks are calling it, have been really kind of hard to bear. Um, I wonder if you can speak to, I know you touched on this, the organizations that you contract um, with the city funds. What are can you give some examples of the types of service providers? Are these, basic needs services, behavioral health, just so folks understand kind of the breadth and the depth of providers that you partner with at the city?
Yeah, so I believe currently we're contracting with 64 organizations, and yes, they do get put into these larger categories. It could be anywhere from Reach to 211, to diapers for homeless individuals and families. So it's meant to be this larger smattering of if you're in need, these may be the groups. What we're interested in trying to do is how many of them are in the city or mobile or local, because what we're doing is it's a wonderful concept to do that broad net, but what we're also making people do is go probably regionally just to obtain resources. And so we're looking to prioritize, maybe fund less organizations with hopefully more money is the goal, and prioritize locality so that we're not inadvertently trying to do a good thing, but creating complexities and barriers for those who are really in the need. And so we have only learned that more recently by requiring in our contracts, not just where you have locations and offices, but where would a Renton resident go to obtain and secure those resources. So we're kind of still on that discovery. I can't list all of them. I'd be more than happy to share. I know, Adam, you have a list of who we funded in the last funding cycle and certainly who we're funding currently, but we're kind of going through our own transition of was that always the best model? But for some, because we have a human services advisory committee who helps select these nonprofits, they really do believe if someone is in need and in benefit, we should be funding some organization. So there is kind of this internal debate of um, how to, who should we fund? You know what I mean?
Yeah, yeah, absolutely. And I think it was exciting for Vickie and Devyna to learn that some of the same organizations that they're partnering with, are ones that the city is partnering with. So that was, new information, I think, for the city and the school to learn that you have shared interests in seeing these providers succeed. I know you've been really working hard to kind of pull this group together, specifically, focused on homelessness and substance use services, and some of the 1590 funds that the city now has access to, and as you said, kind of moving more from a siloed approach to more of this kind of network model, similar to what the school district is moving towards. So would just love to hear some of your thoughts there.
Yeah, I think we knew we were siloed. I don't think we realized how siloed we were, even within the city, our own departments. We weren't always talking and learning from Health Commons. And again, looking at the school district, it prompted us to start asking questions, where we kind of ended up creating this spider web of like, oh, okay, it's not always a lack of funding, because what Adam mentioned is 1590 was a House bill where the city is allowed to collect 1/10 of its sales revenue, tax revenue, and it can go towards affordable housing and resources. And it's a criteria of who qualifies, and there's criteria on these maximums and belows. We're still mapping that out, but it's not, again, always a lack of funding, because that is a decent, very good, healthy amount of money. There's human services funds, but we didn't have the knowledge of how to braid that funding and how to leverage that funding. And again, learning from you, learning from Health Commons is, you're never too big and too old to kind of learn. And this is kind of our epiphany right now, or at least for me, and I don't mind sharing that. But we realized we were not braiding our funding and being creative. We were competing internally as well as making it difficult for outside entities to access. Um, what we're trying to do, we did some one-off projects where you'll see those contracted organizations on the bottom, Project Be Free, Agape. What we realized is we didn't have a lot of knowledge in terms of navigation and what were people experiencing firsthand. We were only relying on information relayed by funded organization. So navigation and just information are what people are experiencing. And also almost think of them as like secret shoppers of breaking our system and testing, are those organizations responsive? Are they providing the need? And we found gaps there where some of the organizations were not easy, and it's no fault of theirs. Our goal is how do we help them be successful, but we do have to build in some sort of accountability. If someone's in crisis, whoever we're finding, hopefully, well, not hopefully, really just needs to be responsive, because that's what that person needs in that moment in time. So this was just an opportunity to try something different. So think of those as kind of a piloted structure and opportunity. And then getting a better handle on our funding. We all tend to be protective. That's why we're in this mayor's retreat right now, because everyone, and even departments and teams, the little you have, you hold on and you tuck it away and you say, I don't have any more. But it's forcing us as an agency now where we need to be a bit more honest and vulnerable and open to the public as well, to say, okay, this is what we do have. How do we leverage this? So that is also a new strategy, a new approach. And then honestly, just looking at the bigger picture of how to map it and how to coordinate it. We're still not successfully integrated. It is the goal. But I think this is just where we're at today, which is it's almost like getting your health report from the doctor. Turns out we have high cholesterol, things like that. So we're kind of learning we have some areas of improvement, but we also have huge opportunity. So that's kind of our journey right now. That's our health report you're looking at.
Thank you so much, Mary Jane, and so well said. I think if there was a silver lining, which is hard to see with the pandemic, I think it did shine a light on how much work we have to do as communities to make sure that we can provide regular access and low barrier access to our community members to make sure they get the services that they need. And I think, as you said, the opportunities are great. We're kind of living in a before and after moment, where hopefully we can take the lessons that we've learned here over the last several years and really seize the opportunity to build the new world. So inspired by your leadership, and we'll look forward to having you on in future sessions and continuing to work together between the city and the school district. So thanks so much.
Yeah, thank you. And again, I just want to applaud Devyna and Victoria. Thank you for doing the work. Thank you for having the vision and the execution and all the providers and partners. And yeah, the city, give us a chance. We could do more. We could do better. And so we look forward to working with you some more.
Fantastic. So I think next we're going to pass it back over to Vickie and Devyna, who are going to give us a little bit of a forward look, talking about seizing this opportunity, about what's ahead in 2024.
All right, I will start by telling you that while Devyna calls the Referral Hub her baby, social emotional learning in a school district is mine. I just love schools that are willing to look at the research, look at best practices, evidence-based practices, and then implement and continue and do continuous improvement. So the Renton School District is not new to social emotional learning. They've been doing this for a very long time. And I was hired to just keep the momentum of that going 7 years ago. So this is just what you see written here is not all that we've done. It's what we're hoping to do coming up. So the next thing that we're working to do is to continue to expand our partnership with the Sounders Rave and Providence Foundations to expand our work to be well curriculum and advisory to additional schools. Devyna mentioned that we're in 4 intentionally now, as well as a lot of other projects going on in the other schools, but this building of these mental health work to be well clubs and things, we're planning by next year to be in all 4 of our secondary high schools. So we're excited about that expansion coming up. And just the next thing that kind of excites us around this work is that we have, as a part of our social emotional learning implementation, um, tapped into some of our schools as intensive learning sites or pilot schools to see what it would look like to be really intentional, bringing in school-wide social emotional learning and classroom practices. And our intensive learning sites are in the coming year phasing out because we have learned what we want to from them and are ready to go district-wide. So all of our elementary schools that were intensive learning sites will continue in that work, but now all of our Renton elementary schools, as well as our middle and high schools, but very intentionally, our elementary schools will be implementing SEL curriculum and practices across the board. So they will all have a school improvement plan that includes a social emotional learning goal, and we will work together towards that goal. So those are some of our upcoming next steps that we're excited about. And Devyna.
Thank you. So we've been fortunate to have funding through King County Behavioral Health to expand to 2 additional schools. And so we are expanding to McKnight Middle School and Risdon Middle School next year. And so we will continue to screen our students at Dimmitt Middle School and then expand at Nelson Middle School to be the entire 7th grade level while we work on implementing this at the 2 other additional schools. In regards to the Renton Referral Hub, as we continue to expand that to other schools, there's going to be a technical upgrade to the Renton Referral Hub process and tools that's going to be ready for this coming school year. Can you believe it's 2024, y'all? So, for next school year, and with that, we are going to expand looking at the co-design for additional screening and the pathways for referring students with multiple needs. So for basic needs with housing, food, those type of things, as well as continuing to provide those referral connections for our mental health providers, and then looking at what are some of the pro-social things, mentorship programs, or any other programs that can help really address the social emotional needs of our students? And in order for us to do this work, we have to sustain it as well, right? So Adam, can you go ahead and speak to that, please?
Yeah, so this is an area, obviously, that the school district and the city are really focused on. Is we don't want to build stuff that's going to fall in the ocean. So we need to figure out how to make sure we have an economic model and financing partners that can sustain these both on the social emotional learning side, but also in terms of the screening and forming our network of partners. Not only making sure that we can sustain this infrastructure that's kind of running across the school district and the community providers, but we know what's critically important and probably top of mind for a lot of folks on this call is how to improve provider reimbursements. We know the county, specifically King County Integrated Care Network, has been doing a lot of work around how to make sure that providers can get accurate and timely reimbursements. We're looking into ways to make sure that we can, similarly braid funding together and ensure that these services first, so kids and families can get served. And then, of course, a big part of sustainability is if you're going to put a network together, is making sure that we're all, have our North Star and are moving in the same direction. So we'll continue to host these learning network sessions as part of that sustainability plan. At this point, it would be great to open it up. We've got about 15 minutes or so. Vickie and Devyna and MaryJane have been doing a lot of kind of sharing of what we've accomplished and where we're headed. Would love to open it up to the rest of you to hear feedback, questions, concerns. What would you like to see on these 2024 goals? What are your own 2024 goals? So really, this is an open space for you all to jump in. So don't be shy. Come off mute or type into the chat.
Michelle Starkey here. I'm the McKinney-Vento liaison for Renton schools, and I'm most excited about McKinney-Vento for Solace for homeless youth and families. And I'm most interested in the co-design and screening and referral pathways for students who have multiple needs. So the basic needs part of the part of the coin. And when I see all of the different organizations, I've seen the service guide from City of Renton. And I think that our biggest challenge is how to kind of reduce the friction between the families and the service, right? So we're giving our families lists of numbers to call and places to go. And when I hear well, they should go here, they should go there, transportation is obviously an issue. And so the more seamless the referral pathways are, then to the real service, not just more case management where we pass you again to the next place that case manages you and then passes you on to the next place. I think for each organization to figure out what they really do, right? And to highlight that every door can be the right door, but let's make sure we get in one stab the family then to the real service that they need.
Thank you, Michelle. That's so well said. And I think a big opportunity for us to kind of leverage some of the learnings from this past year, where we were able to successfully kind of do a baton pass for a kiddo with a behavioral health need and match them into a behavioral health service provider. So that kind of one-to-one match, I wouldn't say nailed it, but we're taking a big step forward. And then the next challenge, as you said, I think is, kids with multiple needs, how do you start to really organize those handoffs and reduce the friction? Super important.
Okay, if I add, my name's Lawrence Davis. I'm from Puget Sound ESD. I'm the school safety program manager. And I had an opportunity to meet with Devyna, and I think just through accident, the conversation about the portal and some of the work you're doing in Renton really amazed me, first of all. And I thought, wow, that is a great opportunity to learn more about it. And the angle I'm coming from with my question is we do a lot of threat assessments. And we're talking about targeted violence and students that may have made a threat to a school. And through that process, we're teasing out a lot of different things of what are the things leading up to a young person getting to the point where they may pose a threat to a school. And as we go through that threat assessment process, we're looking at all those different inhibitors, needs of families, mental health, suicidal ideations, all these different things. And we try to provide a recommendation to school districts. And there's a lot of groundwork that goes into that, trying to find the right appropriate supports for a student and families from that preventative sense. and just trying to figure out if there are better ways to be more intentional in how we, and Michelle kind of stated that a little bit with some of her statements of just saying, we don't necessarily want to constantly pass students on and families on to these different systems, and they're just not getting into the right place. And it's very critical when it comes to, students that may be posing a threat, right? How do we get them to support instead of throw them away, in a sense, into the juvenile justice system and things of that nature? But how do we provide support to those students to get them in the right places, to get the help they need, as well as families? That's, things that are going on in homes sometimes, with supervision, right? What's going on in the community that are causing students to go down that pathway to violence, in a sense. And so, I know we talked about SBIRT a little bit and the quick assessment that goes into that. And the conversation I had with Devyna was, as we do a threat assessment on a student and mental health, suicide, and ideation pops up in that threat assessment, is there a possibility to go towards that SBIRT piece, which would lead to that portal in a way to help navigate services for families and students? Now, I'm thinking of a big picture, because we work with 35 school districts, but I thought this was like, what you're doing is amazing. And so I asked her, hey, can I join just to hear a little bit about what Renton is doing? Because it's something I'm not seeing in some of the districts we're working with. And so to learn more about it, to be able to share this with our agency and how we can implement it as well, and how we can talk to other districts about some of the work you're doing.
I'm happy to jump in with an answer, but really would rely on Vickie and Devyna here. I mean, first and foremost, Lawrence, thank you for the work that you do, and thank you for joining the session. I think in good news, the infrastructure that we're building together is incredibly flexible, and so we say as Health Commons, the kind of systemization and technology pieces, that's about 2% of the problem, where a lot of the work comes in, and the opportunity is to have to put in an organizational structure and evidence based practice kind of service and workflow like SB-SBIRT, where we can really start to get the humans organized, the school support staff, the community providers, and make sure that we're doing the right sorts of screenings, that we're triaging kids at the right level, and then doing those kind of baton passes across agencies with an ability to kind of track states and statuses, and also get the closed feedback loop, which I think is a big part of what everybody wants to see. If I send somebody here, how do I know that they're getting served? And who is holding those providers accountable to make sure that student or family is getting the services they need? So I think that the encouraging thing is we're at a moment in time where we have the ability to kind of put in these new services and workflows and systems across agencies. And what we've been really excited about is when you have, partner with King County and Seattle Children's and Renton School District and City of Renton, you can now start to put these kind of structures in place. So, from my standpoint, if Vickie and Devyna are interested, would be an invitation, as we start to co-design some of these other referral pathways. It would be, very interesting to look at kind of one of those screening and referral pathways being related to threat assessment. So Vickie, Devyna, I don't know, is that something that you all would be interested in exploring?
Yes, and oftentimes I'm involved in the threat assessment process, and especially that's how I receive my referrals. So my background is in social work, and so whenever we do have students, as far as connecting them to those resources, I'm the human version of a hub, right? But I think it goes as far as what Adam was saying, right? Like that communication, that closed loop of a communication or that closed loop system is not what we currently have. And that is the hope with that referral pathway and looking at, okay, not just mental health, right? So right now, like if, let's say, for example, if we were to do a threat assessment and the student is in need of mental health services, yes, I can refer them through the Renton Referral Hub, right? But as far as typically there's multiple needs, right? And so that the family might be struggling with and not just the student. And so being able to find ways to get them connected or to get them connected to different services at once is, I mean, I think that's a dream that a lot of us have, right? As we do the work. And so that is the hope, is that we will be able to expand that to be able to address those needs. And it's definitely, as far as, the threat assessment process and doing a screener to identify those needs, yes, that can happen as well. Because the thing with SB-SBIRT is that it doesn't have to just be a universal screener. There can be a screener that a student, like if we identify that the student might be struggling with something, we can ask them to take that screener. It is something that they can opt out of, though. So it's not a requirement, but it doesn't mean that we can't refer them just because they didn't complete it. And so we still refer based on the need. So I think, with the expansion of it, our hope is that we'll be able to address some of those other needs that aren't, that we're not able to address right now through the Renton Referral Hub, since it's just focused on mental health providers.
A note in the chat here, around the bill HB 2280 that's up in the session, that's really focused on this work. And I think what's encouraging, as we said before, is there's a lot of alignment, I think, at the local level around what folks see as the need, and some of the progress that's being made, and then at the federal level and state level, that there's alignment with the policy. So a very unique moment in time where we have alignment between local and state. And I see a question from, I hope I'm pronouncing your name right, Mihad, is an access specialist at CCS. We provide mental and behavioral health services. Oh, great. Yeah. I think, thank you for that, Mihad. I think Renton School District and is really the place to go if you're interested in kind of joining the Renton Referral Hub, working specifically with Devyna. Devyna, I don't know if you can drop your information in the chat, but she will be your point person. It's really Renton School District's network, and we're just the helper to help them get it set up.
Yeah, Adam, this is Delaney. Sorry, my camera's not on. Hey everyone, my name's Delaney Not Nearest, and I'm the King County Program Manager for School-Based SBIRT. So we just wanted to chime in that if there is a conversation, Devyna, that you have with Lawrence, I think it would be really interesting to talk more about how SB-SBIRT can or cannot, like what does fit and maybe what does not fit with the needs when identifying students for a threat assessment. Because it's always meant to, like you were saying, Devyna, be a voluntary process, as well as be one that is non-punitive, and making sure that we're changing culture so that students are seeking help and wanting to connect with adults. And I have had some anecdotal stories where students have gone to the SBIRT coordinator or interventionist and have disclosed, like, I'm worried about hurting others, or I'm worried about this situation having happened that is connected to the threat assessments, but since I'm not super familiar with what those look like or what the needs are, I just wanted to chime in that wanting to be a part of that conversation, if that makes sense.
Yes, no problem. I can coordinate a meeting. Thank you.
Yeah, love it. And I think Lawrence in particular, your having county, the work that you're doing at PSCSD, and then if there's an opportunity to put a kind of a pilot project together around what a screening and referral way might look like, that would be very exciting to join forces on. Yeah, thanks, Delaney. Well, thanks everyone. Really appreciate everybody's participation today. I know you all are incredibly busy and have lots of obligations to attend to. So thank you for making the time and the space to join us here. We'll reach out later this year regarding the next Learning Network session. So look forward to seeing you there. Thanks all.
Thank you, everyone.
Thank you. It's nice having you.
Have a great day.